Hello, everyone, and welcome to our webinar today, the second webinar of our summer series, Investing in Lifetimes, Using Our History to Enhance Our Impact, with Dr. David Anderson, Professor Emeritus at George Mason University. I'm Cindy Clowner with the Higher Education Center, and I'm so glad that you're able to join us today. Before we begin, we just have a little bit of housekeeping that we'd like to go over. Dr. Anderson has some great information that he's going to be sharing with you, and you may have questions about that. If you do, you're welcome to submit those questions in your right-hand toolbar. They will be posed to Dr. Anderson at the end of our webinar for him to respond to. We also want to mention our membership. This is a great way to learn more about what's happening with the Higher Education Center and have access to all of our tools and resources. If you have any end of the year funds that you need to spend down, consider joining the Higher Education Center as a campus or individual member. Here's a little bit of detail about what comes with our membership and the costs associated with those. And we're happy to answer any questions that you might have after the webinar by emailing hecaod@osu.edu. And with that, it's my great pleasure to introduce Dr. David Anderson, who is a Professor Emeritus of Education and Human Development at George Mason University, where he worked for over 28 years. He served as Professor and Director of the Center for the Advancement of Public Health. Prior to that, he served as a college administrator at The Ohio State University, Radford University, and Ohio University. Over his career, he conducted hundreds of national, state, and local projects while teaching graduate and undergraduate classes. He is an active researcher with decade-long research on college drug and alcohol issues, high school youth, and community efforts. His work emphasizes practical applications and for youth and parents, school and community leaders, program planners, and policymakers. He is the co-author of the College Alcohol Survey from 1979 to 2018, the research Understanding Teen Drinking Cultures in America, and Promising Practices, Campus Alcohol Strategies. His most recent books are Wellness Issues for Higher Education, Further Wellness Issues for Higher Education, and Health and Safety Communication, A Practical Guide Forward. Currently, he is a leadership in drug and alcohol abuse prevention insights from long-term advocates. He serves as president of the board of directors for the Celebration Residential Owners Association in Celebration, Florida. Dr. David Anderson, it is a pleasure to have you today.
Thank you, Cindy. It's a delight to be here. Thank you, everyone, for joining in on this Flag Day, June of 2018. I am broadcasting, it's not the image that's on the screen right now, but I am broadcasting from Celebration, Florida, where I live now. And that's what Professor Emeritus is. After a long career working full-time in committees and research and teaching, I'm still doing a lot of that, not the committees and not the teaching, but still continuing my research. So thank you for joining us this afternoon for our hour together, investing in lifetimes, using our history to enhance our impact. We have three learning outcomes for today. First one that you can see on the screen, understanding the historical context of campus efforts addressing drug and alcohol abuse. So we're going to look at that, and you might wonder, why are we interested in history? Well, we can learn from our history, we can build on it, it gives us some perspective. We may decide to continue certain things, and we may decide to go in some other directions. So certainly we can learn from what we've accomplished and what could be done better. And that's really the title of this, ways of enhancing our impact. All of us, regardless of our role, and we'll see what that is momentarily, which our roles are momentarily, we really believe that we just don't, or I believe that none of us want to be doing things just to be doing things. We really want to have impact. Second learning outcome is learn about areas of progress and gaps and within the context of a comprehensive strategy. Certainly single efforts are not what we need to be doing, just do a thing or do an awareness week or a program or a brochure. No, we need to be comprehensive in our thinking, and we'll see that that'll permeate all the content today. And then to identify some specific short and longer term approaches that you as an individual, you as a team member, you as a leader on a campus, whatever your role is, or in the community or in a state or national group, what sort of specific long and short-term approach you can do. We're going to look at some resources and some strategies. I'll highlight particularly the Drug Enforcement Administration and NIAAA and CSAP. We'll see what the Higher Education Center has to offer, and look at ways of being more collaborative, and whether you convene a group or you have a task force, or ways of finding personal support for what you're doing for our college campuses. With this and other webinars that the Higher Education Center are offering, you'll be thinking about some next steps that are appropriate for you. So within that, our outline is a quick overview, which is where we are. We'll be looking at then drug and alcohol problems over time, then specifically on policies, programs, services, and other campus efforts. We'll take a look at obstacles. What are some of the obstacles in our way, and what are some of the resources? Certainly we can have several webinars just on resources. And then some conclusions, some of my own reflections on this. Let me start with some pictures. These come from Radford University. I learned at a meeting, I moved from Virginia about 2.5 years ago, and I learned at a meeting right in my last days in Virginia at a statewide conference, Bonnie Hurlbert, who was Dean of Students, was honored for her statewide service. She was Dean of Students at Radford, and she and I had some time together there. We overlapped. I was Director of Residence Life for a few years there. And they built a student center. And I was very impressed that the label over the main entrance was investing in lifetimes. And that really spoke to me, and it really honored what Bonnie was all about. And to me, that's what I'm about, and I expect that that's what many of you are about with your various roles on the campus. And it's really an investment in the lifetimes, particularly of the students with whom we come in contact. So within that context, let's look at some polling slides. And Cindy's going to take this over now. Let's just find out who is on board, who is on the webinar. So which best, we're going to have 4 quick questions. Just select one of these. Which best describes your role? Please select one of those, and then we will all see the results. So which of these best describes? I was limited to 5 choices. So which one best describes you? All right, so let's see what we have. I don't know, Cindy, if you can tell how many have responded, but here's what the response pattern looks like. 67% doing alcohol, drugs, wellness, and health promotion, something in that. Residential life, interesting. And other, now we don't know what the other is, but that'll be an interesting query, but very nice to see that. Let's do the second question. This is which best describes your affiliation. So the affiliation might be a college campus, you might be in graduate studies on campus, you might be a community volunteer or leader, or with some state or national agency or something else. Couple more seconds, this is not hard. The harder ones will come later. And here's the results that you have, 80% on our college campus. And it's nice that we see several from state or local national agencies and some from the community. That's marvelous. Let's look at our third question. Which is closest to the percentage of time you spend in your professional role addressing drug or alcohol issues? So whether you're the alcohol drug coordinator, or whether you are in residence life or one of those other categories, what's the percentage of time you spend in prevention, in research, in treatment, and other support services? Okay, and let's see what the results are there. Interesting, no one says 0. Interesting. And 100%, that's just under a third. Just over a third are spending 25% or less. Okay, and the last demographic is how many years have you worked with drug and alcohol issues, at least in a substantive way as a professional? How many years? Are you relatively new, whether it's 1 year, half a year, a couple months, you were just appointed, or more than 20? Some of us are in that category or beyond. And here's what your response is. Interesting. So we have a seasoned audience. We have over 1/3, 38%, with over 10 years. Very interesting. That's a marvelous spread. And we have just under a quarter with 2 years or less. And thank you, Cindy, and thank you for doing that. And just as as Cindy introduced, I served actually 14 years as a student affairs administrator, either as a grad student or full-time, and it was mainly in residence life. My very first alcohol education program was in 1975. And that was at The Ohio State University. And sadly, part of my own experience with drug and alcohol issues is one of the saddest experiences in my life was when a young lady overdosed on drugs in my residence hall at Ohio State. And one of my untrained for responsibilities was helping carry her body out of the building. And then a few years later, when I was at Radford, 2 of my 4 professional staff were killed by a drunk driver. And obviously that's part of my background and part of my beginning. While I was at Radford, I helped to start the alcohol consciousness team. That was in the mid 70s, or late 70s rather. Co-authored my first book, started the alcohol survey. I started Virginia Tech's alcohol and drug office. My doctoral dissertation about 35 years ago was on drunk driving. And so a lot of my research is on this. I work with Compass that we'll see near the end of this presentation. Also helped to work with statewide coalition in Virginia and continuing my passion with this. So let's get started with this. And I may need, let's see. Okay, so we are looking at campus drug and alcohol problems over time. So we're going to take a look at a lot of the longitudinal work that exists on alcohol and drug issues. And this comes from the College Alcohol Survey. This is something that I co-authored with Angelo Gadoletto starting in 1979. I've continued it with another co-author now. It's unfunded research. It's done with a sampling of colleges, 330 colleges that we started in 1979. These are 4-year schools. We've had a great response rate, and we're analyzing the 2018 data now. So that will be forthcoming. You'll see a couple of highlights from 2018 in this presentation. Just a couple of highlights. But here's a slide that really, if you will, compiles what is happening on the campus. What we see on the bottom line here is that not from our survey, but it's from the Monitoring the Future study done by Lloyd Johnston and his colleagues at the University of Michigan. And what you see there is the heavier drinking, the 5 or more drinks at least once in the last 2 weeks. And basically that's gone down in recent years, but for the most part, it's been pretty resistant to change. Some people call that binge drinking. And what you see over on if you will, the triangles, the yellow triangles, this is our campus effort. We went up tremendously, and you'll see some evidence of this in a couple of the slides that come. We've gone up tremendously in the 1980s with our effort. Didn't see the results down here, but we went up in our effort. That then went down, and more recently it's gone down a little further. This is not quantitative. This is based on probably 200 variables. But what you'll see here is that our effort has gone down, and we'll see what happens in the future with that. So let's take a snapshot. 2015 is the most recent data for most of these slides. I'll highlight where the 2018, I pulled out some select 2018 data just for taking a look at where we are. So this is alcohol's involvement with campus behaviors. And this is reported by campus administrators, whether they have data or whether it's their subjective judgment. You see that alcohol is involved with about half of our campus behavioral problems. Can you imagine what our campus would be like if we didn't have that? How about alcohol's involvement with personal behaviors, whether it's health center or physical injury or unsafe sex or acquaintance rate? And then the next slide is academic issues, really the crux of a lot of our campus efforts. Now, I share these for you and share these with you and all of these slides. There's a lot of slides here. So you can go back in them, you can clip some of these. These are up on our website, which I'll highlight later, on my website at George Mason University. But you can extract these for your own planning purposes or for your own illustration purpose or purposes, or take a part of this webinar and share it with a leadership group or some, and to say, hey, what can we do about this? Now, looking at those same 3 clusters of alcohol's involvement, here it is over time. And I've added preliminary data for 2018. You see that over here on the right side. But what you saw here in the prior 3 slides was this column right here, 2015. And what you see if you look at this over time is, yes, alcohol's involvement has gone down, but it's gone down slowly. Alcohol's involvement has gone down with all of these, but it's gone down slowly. Couple things like this one right here on safe sex went up in 2018. Again, preliminary data. We'll see if that holds. Who knows what's going to happen in 2021 is that a trend or is that something short-lived? And then the last one is academic problems. Again, we do see alcohol's involvement going down. That is good news, but it's also relatively slow. Now let's look at what our campuses are doing. And here's my framework, if you will, for a comprehensive campus effort. Yes, we need policies, but that can't be 100% of our effort. Yes, we need prevention. That too cannot be 100% of our effort. All of these things are important. So let me take this point and ask you a question on this. Well, a query here would be if campuses were doing, and this is where we're going to have the polling question, which is on the screen now. If campuses reported doing all the items, now those 6 items, I'm going to show you some data and some numbers from the College Alcohol Survey, but if all the campuses were doing everything at their top level, and everything was weighted equally, meaning policies equaled prevention and education, which equaled support services, they were all equally aligned, what would the score be? I mean, the maximum score is 100%. If a campus is doing nothing, they would get 0. What do you think the average score from the respondents from the College Alcohol Survey, because that's the data sample we have, because we've gone in and plugged in their numbers and weighted everything equally. What's the score? I'll give you the number after you respond. But what would you say the score is? Is it 35%? That would be the score, or do they max out at 85? So the answer is close to one of these 5 numbers. What is it? Couple seconds to respond, and let's see what your responses are. Okay, you're saying 38% of you say that it's at 65%. Interesting. And 36 say it's low, yeah. And nobody's putting it at 75 or 85%. You all are correct. So let's go back and look at what the answer is for 2015. I don't have 2018 data yet, but here's 2015 and here's 2012. The answer is coming up. Trying to move the slide forward. Here's the slide. So 2015 here on the right, our score is 52. So a bunch of you were right. Some of you were a little higher, some of you were a little lower, but that is down from our score in 2012. And what you see here is arrayed as the actual scores of the schools where we actually coded them. I should also point out that in 2012, we actually did weight the 6 areas. So they might have been weighted a little differently. Something was 20%, something else was 15%. And I involved the regional network coordinators who were active at that time to actually do the weighting. And what we found is when we weighted things and we did not weight things, they were roughly the same results. So now we're not weighting, and what we'll see that right here, it's 52%. So about half of what we could be doing. Now, if we go on in each of the 6 areas, you'll see now the mean score for that area. So we're doing about half of what we could be doing. And again, this is based on the questions that we ask that have a desired response in the College Alcohol Survey. All right, so now as we look at this, whether alcohol is allowed. Now, this was not a scored question, meaning it's not good or bad. You don't get points for not allowing alcohol for allowing alcohol. We just score it differently. But anyway, about 4/5 of our campuses do allow alcohol. It's the circumstances under which alcohol is permitted that have changed over time. Alternative beverages, again, you see that big change back here from the 70s. Clearly, most campuses, not all, require an alternative beverage. Food, 3/4 of our campuses require food. Now, again, as we look at this data, what can you do with history? Well, you can say, maybe we need to be closing that gap. Maybe that should be 100%. What can we do? Let's look at our own campus. Can you advertise the availability of alcohol? About 1/3 of our campuses. Do you have a place where you can purchase a drink? Do you require training of your servers? We have a lot of campuses that do not require training of servers, interestingly. Do you inform parents for drug alcohol infractions under age 21? That's 4 out of 5. Do you prohibit low price or free drinks or specials? Do you schedule core classes on Friday mornings over 3/4? Do you do it with the intent of reducing drinking? Just 11%. Do you have policies about alcohol advertising? And again, you can read that. You can go back and review this. You can pull these down from online posting. Do you have a policy? The bottom line, the red line, is do you have a policy? So that's about 50% have a policy. And if you have a policy, does it prohibit these things, advertising, promotions, or sponsorship? Do you have an amnesty policy? So we asked that question for the first time in 2012. Here's some preliminary data that seemed to be growing, and we've done some more separation in the 2018 survey where we're separating an old question, separating it from alcohol versus illicit drugs, okay, and sometimes separate for marijuana. And then a new question on Good Samaritan policies. 3/4 of our campuses have that. Again, we don't have any detail of what that is. That can be a follow-on query. Do students face judicial charges for behavior that occurs off campus? 3/4, no real difference for alcohol versus illicit drugs. Do you have input into the licensing process? Now, we added the marijuana one because we know that states have legalized marijuana, and might it be appropriate for a campus to have input into the local licensing process? And only 11% of campuses do. Again, maybe an opportunity for growth. Prevention education, our score is about 60%. Do you have an awareness week? This is where a lot of our efforts started. It was 13%. That's really one of our initial things, and that was my first book, co-authored book at Radford. Do you have an awareness week on drugs? That has gone up. While alcohol has gone down in recent years, drug awareness weeks or days have gone up. With your current efforts, do you have social norms? And so we say that's pretty flat in the last half dozen years. And this is on a 4-point scale, and you're rating yourself. Campus is rating itself. You see individual motivational interviewing going up. Again, rating itself. To what extent is it involved? Do you pay attention? There's 3 slides here. Do you pay attention to the needs of subpopulations? We know that various populations, freshmen, student athletes, fraternities and sororities, and so forth, have unique needs, special needs with respect to alcohol and other drugs. And so we see growth with paying attention to the needs of freshmen. Not so much growth, they're higher than the rest, but no particular growth with student athletes or fraternity, sorority, or women. Now, again, we'll go down from here in how much a campus is paying attention. People of color, commuters, gay, lesbian, bisexual, people with disabilities, all of those are going down, but they already started out low. So here we knew, this is what's interesting to me, is we knew on some of these, over on the left side, we knew 20 years ago that we weren't paying much attention to at least the gay, lesbian group and people of color grouping of individuals. And we didn't do a whole lot better. Maybe a little improvement here, but not a whole lot, still low. And then how about students turning 21 or grad students or veterans or men? So we have a long ways to go because different groups, different groupings have special needs. How about campus approaches for dealing with substance misuse, whether it's orientation? Again, a lot of growth there. Student programming in a peer group, we see increase here. We'll see more of that in a moment. Programmatic approaches, again, this is 2015. We've seen a massive growth with the web and internet and online education. I'll be interested to see how these score in the recent data from this spring. You should watch for that coming out this summer. Then we look at curriculum and training, score of 43. So what's interesting here is we said, to what extent does your campus provide assistance for faculty on these issues? And what you see here is, while it starts out pretty low, again, even with this top one, intervention and referral services for mental health or or drug and alcohol. So what we see here is while it went up for just a bit for 2012, in 2015, all of these are lower. So again, we've receded a bit on that. Again, we'll see what happens in 2018. But the other piece is tremendous opportunity with all of these issues with faculty. And I know faculty are hard to reach. Even with other faculty trying to reach faculty, it's hard to get others involved. Support services, a big issue, an important issue. Not a whole lot of change, but it was already pretty high. To what extent can a student with a drinking problem receive counseling assistance? How about group counseling for problem drinkers? So in 2015, that was 51%. Now, we now have 3 clusters on that. This is preliminary data for 2018. The 51 is now 49 for 2018 for group counseling for problem drinkers. Marijuana, a little less, and other drugs, a little less than that. Similarly, do you have a support group, like an Al-Anon type group? 39% here in 2015. Similar question now. 2018, this is for alcohol, and on the right side, the 23% is for marijuana or other drugs. This is support groups for one who has a loved one who's been using or has issues with that. Employee assistance programs going up. Paraprofessional staff getting training, big jump in that in 2015. Now, where do our referrals come from? So if we have an individual, a student who's screened by a health professional, 40%, 41% come from judicial violation. So that's something to take a look at and not to negate that. That is very important. It's a big source of someone getting, if you will, in the system and getting seen by a professional. But tremendous opportunities over here for growth, self-referral. Maybe there can be some public awareness campaigns to help self-refer or peers to refer or our undergraduate staff. And of course, at the bottom, the faculty. Recovery services. We started asking this question in 2015. We'll see what happens. I fully expect this will all grow. All of these will grow in 2018. This has been a major priority for the Higher Ed Center, as well as many campuses. And that's an important thing, and I'm glad to see that is growing. And then what sort of services and approaches are offered for those with a substance use disorder diagnosis? And this is what we see. Can I expect more growth on those? Evaluation is our next to the last topic. 43 is our score of what we could be doing. You see a tremendous growth here. A lot of that was driven, I think, by federal funding. If you will, 50 grants back here in the 80s and early 90s, and then campuses accepting that this is really important to be gathering that sort of data. A similar pattern with surveys on drug use. And again, we probably have 20 different sub-questions on this. Here are some of the highlights. The full set of results you will find on my website. And again, I'll point to that as we get to that point at the end. Survey conducted on other health and safety topics. Again, lots of opportunities, knowledge of prescription drug abuse. We see that growing nationally, but we don't see the attention to gathering data from our students and their knowledge on that. And hopefully that's an opportunity for growth. Have you done a survey about faculty engagement? Again, a major opportunity. Have you done an assessment on drug and alcohol policies related to liability? We stopped that question in 2012 because we saw that it was kind of flattening out. That used to be more of a motivator back in the late 80s. It's not so much of a motivator today, guiding campus efforts. But here's a parallel question. Have you done the last couple of years, have you conducted a formal assessment on the effectiveness of its drug and alcohol misuse prevention programs? You see, again, our most recent data, just over half. And I'm sure there's a webinar on this that Cindy has done or others have done. That's a federal requirement to do that every 2 years. And that's why we started asking the question. We didn't say, are you following the law? But that's the foundation of that question. It's also a good idea about doing a formal assessment of the effectiveness. Again, that goes to the title of our program, about having an impact. What sort of strategies are you using for measuring campus efforts? Trying to get a handle on what campuses are doing. And I know I'm going quickly in here just to highlight this. We're about halfway through, and I just, again, we can go back and you can go back and you can do follow-up queries with me or other dialogue with others about how you might move forward with these. Planning and collaboration is interesting. Again, about 59% is a score. Actually, let me go back, Cindy, with a question, a query question. And this is about how much funding is provided annually. Now, the dollar figure you saw there was not a per capita figure. That was a campus figure. We'll come back to that. But this is a per capita question. How much funding is provided annually per capita for campus AOD and wellness programming? So without personnel, what's the annual budget for a campus per student? What's the annual budget? And the source of the information is our four-year colleges. Okay, is it $1, $2, $4, $10, or $25? What would you say? All right, so Cindy, let's see what they have said. And their answer is we have 42% saying $2. Very good, and nobody is saying $10 or $25. We got a smart group here. So let's go back to the slides themselves. And what we have is trying to move this. Okay, so let's go. So here is the total amount. This is on alcohol and substance misuse and on wellness. So alcohol and drugs is about half of the overall wellness funding. Again, this excludes personnel, and this is the average across campuses, where the campus is the unit of analysis. Here it is per capita. So here's the answer to the question. It's about $4. So a bunch of you got that right. You're right on the money. And even with $4 does not go very far for any of us who've had campus budgets. Do you have a coordinator? 9 out of 10 schools have a coordinator, whether he or she is full-time or part-time. You have someone designated. How does he or she spend their time? And you'll see that about 20% of their time is on counseling, a little over a quarter is on education, about 10% is on assessment, but a whole range of skills. And that's a lot of hats. That's a lot of hats that the majority of you who are signed on to this are wearing. And your training may be in counseling, or your training may be in health promotion or wellness or education or community health. Your training may be more in research. Typically, training is not across the board, and that's a challenge. How do you spend your time on which sort of topics? Alcohol is a little over a third, violence is a little over a quarter. So this is how campus coordinators and campus administrators report that campus personnel spend their time. And then if you will go back, we'll just go back to this drug area, which is just 10%. And how does that drug area divide itself? About half is marijuana. About half is marijuana. And so you see prescription drugs is about 20%. Again, I'll be interested to see how that plays out for 2018. Now, do you use peer groups? About 55% use peer groups. And with that 55%, how are they using their time? Educational workshops, health awareness, and so forth. Again, lots of opportunities for the peers that most of us believe in. How about collaboration? Again, what you see with 2015 data is most of this collaboration has gone down since 2012. Again, I don't know what's behind that. Do you have support of your president or chancellor? 3.75 on a 5-point scale. Do you have a strategic plan? Just over half of our campuses have a formalized plan. It's affirming that nearly 3/4 have measurable outcomes and a timeline, which is good. So do you use designated resources? This is a new question. Do you use NIAAA's alcohol intervention matrix? Do you use the CAS professional standards? On a 5-point scale, this is where we are. Again, tremendous opportunities, great resources for doing some assessment for yourself and some, if you will, benchmarks, and not used as much as I thought they would be. Extent to which recent focus on sexual assault has resulted in increased attention to alcohol abuse, 3.38 on a 5-point scale, preliminary data. Do you collaborate? So the collaboration with statewide efforts, we're just over 60% on all of these. Again, tremendous opportunities for working together. So here are my key observations. This will end the college I'll call survey slides. Then I'm going to move into a couple other areas. Our campus efforts seem to have stagnated over the last couple decades and seem to be declining now. We see that in 2012 to 15 data. We'll see what happens with our scores for 18. Personnel expected to manage a variety of different tasks. Data collection has increased. Unique needs of various groups hasn't changed over time. Many campuses do not engage in substantive strategic planning. Faculty not used widely. Self-appraisals are lacking. That's your looking at effectiveness. Student engagement is limited. Top leadership does not seem to translate into resource allocation or prioritization. And there's many opportunities for action and collaboration, which is something I hope you've heard me say in this webinar so far. So let's move on to some obstacles. And you may wonder, why are we going to talk about obstacles? Why would we want to do that? Well, you know, I've been around, I've done many campus visits and campus assessments and statewide training and campus training and national seminars, and I hear about a lot of obstacles. So take a look at these. There's several slides that follow. Then I'm going to ask you a question. And I've clustered these into these clusters. There's obstacles that has to do with attitudes like hopelessness and loss of momentum and tradition. How are we going to counter that? And hypocrisy. There's student obstacles. Students feel invincible, lack of communication, different expectations, difficulty in reaching commuters. Students are more interested in their professional development, meaning, you know, I want to get my grades, I want to do my work in my student organizations, but not in these other issues. Faculty and staff, their priorities are different. Publish and perish, publish or perish. Turf issues, curricular content, support and recovery, few community resources, ambiguity, a lot of people not knowing how do they help and how do they know when someone might be in need. Let me just go back for a moment, make sure you're taking a look at these. My question is going to be, the last query question is, to what extent do these resonate for you? Lack of funding, coordinators, program lacks visibility, hard to get police involved, monitoring is like outcomes, difficulty in showing long-term change, no easily observed results. And then my last one here, and then we'll have the query question, is student services have lower priority than academics, alumni, federal priorities, need policies, lack of vision. So then let's go to the last question, Cindy, is to what extent are these listed obstacles accurate? Do they seem to capture what your experience is? Again, the rich experience, the many years of experience that you have, do they seem to capture it? This is my compilation. Okay, so last second to record. And let's see what you said. We don't have a mean score here, but interestingly, for 4 or 5, we have 80%. Very interesting. Now, I must tell you, there was a little small bit of sleight of hand here. Let's go to the next. We need to go to the next slide. Has a little hiccup with, okay, so here was the first slide that I had, but here's the source of that. The source of all of that, it is true that it came from campuses, but it was 30 years ago. And you're going, oh my God. So I was involved with a couple of others in an initiative called Policies and Programs for the 90s. So that was started in 1989. We went around the country, 23 locations. We did team training, 2 days of training, and we generated obstacles. That's the compilation from those workshops. There were 50 people in a workshop, 10 campuses, and that's the compilation. And 80% of you in the webinar said those are accurate. So the point is, we gathered that 30 years ago, and they're still accurate today. That's very troubling. That's very troubling that those same obstacles are there. Certainly there's other obstacles, and some of them are larger and some are smaller. I mean, some of them we've dealt with better, the employee assistance programs, the coordinators, we've dealt with those better. But we have a long ways to go. We have an uphill battle, and that's part of the perspective that I hope I'm providing when we're talking about investing in lifetimes, using our history to enhance our impact. So attention to obstacles. Now, a couple other flavors on obstacles is, these are, I'm not going to go into detail. Some of you may have been in workshops where I've done these, but here are two different studies. I'm showing one slide per study. Again, this could be another webinar looking at these two studies that I helped co-author on wellness issues with student affairs professionals. This one was looking at student affairs professionals and the extent to which they see this as a problem or concern. And so this is the priority of how they viewed this. When Mark Kretovics, he's at Kent State, when he and I looked at student affairs professionals and their preparation programs across the country, this is what we found, where alcohol and illicit drug abuse and prescription drug abuse are arrayed within these other wellness issues in terms of prioritization of how they see the problem or concern. And then with another study I did with Todd Rose and Alex Williams, looking at professional preparation, again, similar sample of student affairs professionals, where did they get their training? And so what you'll see here is, in terms of their preparation, look at some of these. The formal training was very low. In terms of substance abuse, and I'm sorry, the green thing is a little awry there. You'll see that that's pretty low in terms of their preparation, whether it's grad program or in service. And then most of their information comes from being self-taught, and that may resonate for you. Where'd you get your training? A lot of it may be self-taught. So turning now to the last area for this is resources. There are lots of resources out there. There are lots of resources. One of my mantras that I share in training and talks is, where there's the will, there are the ways. You can reframe that. Where there's the will and where's the desire, there's a campus effort. Take a look at COHESAP. Take a look at the NCAA choices. Take a look at NASFA, or take a look at the Higher Education Center. Look at where various resources lie. Again, I've highlighted earlier the DEA and NIAAA. Those are great resources. I mean, the DEA has a new website, campusdrugprevention.gov, and take a look at their views from the field. College AIM came out from NIAAA, collegedrinkingprevention.gov. Those are very, very helpful resources. Now, here's one that's a little more close to home. This is free, and as are the DEA and the NIAAA resources, but this is something that I helped put together. This is on my website at George Mason. This is taking the college alcohol survey questions, and what you see here at the bottom are those areas that we've highlighted: policy, support, prevention, curriculum, evaluation, and planning. And so we have the same sorts of questions, if you will, like here's from the support and intervention services. So these are the same questions right from the college alcohol survey that campuses filled out, and then we share as national results. Well, you can go in there and fill out your response, rate yourself, give yourself a 0 or a 1 or a 4 or a 3 for each of these areas, whether it's prevention or curriculum or evaluation. Do all of that. And then what you'll end up with is, here is the scores that you saw earlier. Those are the scores where everything was added up, and that's what our sample did. Here would be your institution score. So you may go in and you may get a score on policy of 100 or 90, and then you'll see your percentile compared to the other institutions. You can do that. There's 2 different tools available on my website. They're Excel files. They're not pretty, but they're functional. And you can have your task force, 20 people on it, 10 people on it, fill it out, and then they can get all compiled, and you can do your own self-assessment. That's one of the things you can do. A couple other things. Cindy mentioned my recent publications. This came out my last year at Mason. where we have a chapter, each written by an expert on one of those topics. So the assignment was in 7,000 to 10,000 words, share the latest knowledge on that topic and what a campus can do about it. And so then I did a follow-on book, Further Wellness Issues for Our Education, and I'm considering a third one. So again, these different topics with names that you will recognize a lot of those names, and they've given their best knowledge and sharing research and strategies for campuses. And then this book came out last year, a year ago. It's Health and Safety Communication. And so you have a chapter on workshops, a chapter on doing testimony before public settings or print materials or campaigns or social media. Again, it's practical and grounded in, if you will, the first part of this is more of the theory and the evaluation things. And then as we start to wrap up, just to highlight, this is the website that I have, and here's the resources page. And then when you go to the resources page, I just wanted to highlight where a lot of these things are that we've talked about, the College Alcohol Survey results, a lot of the slides, summary documents. Something over here is called Compass. That was done, maybe Compass came out of a think tank that was done 20 years ago. Compass was done about 12 years ago with a grant from the U.S. Department of Education. So I just wanted to highlight those as resources for you and places that you can go for more information and further study. As we conclude, here are some final reflections. And then we're going to open this up for questions. So, and I know Cindy will be screening those. Just a few final slides. Overall reflections. I think we've made a lot of progress. We have made a lot of progress. More efforts do exist within the context of comprehensiveness, and it goes way beyond policies and awareness. So I remember a book that I read years ago, maybe 30 years ago. It was called I Ain't Well, But I Sure Am Better. So I think of that with respect to this. We've done a lot more. We know a lot more today than we did 30 years ago. The college aim thing from NIAAA, is a lot of that is based in, or it is based in science, not a lot of it. It is based in science and research. So we do know a lot more. So progress does exist, but it's slow. Drug and alcohol issues as a priority are quite low. Funding and resources limited. Staff members are genuinely committed. So it's probably not you on the webinar, but it's those around you, and it's your support services that they don't really understand and appreciate all that you do. Expertise and understanding of substance misuse issues is limited. Again, if you look at the higher education preparation programs, none of them have a required course on alcohol and drugs, and none have a required course on wellness issues. So many new professionals coming to our campus are not formally trained on these issues. Evaluation is limited. Skills for advocacy and persuasion are limited. That's much of why I co-authored the book on health and safety communication, to help build the confidence of folks. Strategic planning is limited, not done within the big picture of changing the culture, which is vital. This limited attention is not just on campuses, but it's the larger society. And the larger voice of calls to action and leadership are limited. Cindy mentioned the book that I'm working on now. It's called Leadership in Drug and Alcohol Abuse Prevention, Insights from Long-Term Advocates. And so I'm anchoring that around 30 interviews I did with people who've been involved with alcohol and drugs for 30 to 40 years, and some other insights from individuals who are writing shorter segments for the book now. That's due to the publisher in December. Reflections, I still feel hopeful. I still feel hopeful. I feel emboldened. The need is still there, and there's dedicated people. That's part of what helps embolden me. I feel inspired because I see the need, and I'm very concerned with the obstacles that are out there and the challenges we have. Yes, I am frustrated, but I'm still challenged to persevere, and I hope that that's the case for you. And then the last thing is my last recommendations to you is consider your moral responsibility. You know, I have neighbors and friends where I am now as a is an individual who don't understand a lot of what I do with this. But to me, it's a moral responsibility with the background that I have, the tragedies that I started my career with and a drug overdose and drunk driving crash. And then I know probably everyone on this webinar has had someone in their lives where alcohol and drugs cause major problems. And to me, that's a moral responsibility. We're aware of this, and what are we going to do about it? Be research-based is an important recommendation. Use available resources. Again, I highlight the DEA website. Look under prevention there and education. Engage your campus resources. Find allies. Find faculty. Acknowledge your knowledge and your commitment. Be strategic. Find ways to link it to your mission statement and other goals. Gather local information. Do an audit of needs and perceptions and issues. Use data. Be heartfelt, and then persevere. So again, I'll close with something I call the pyramid of success. And again, that's the foundation of the new book that I'm working on leadership and substance abuse prevention. The pyramid of success is competence, confidence, and commitment. Competence is our skills. Confidence is our belief in ourselves, and commitment is our willingness to go the extra mile. So I thank you for your participation here. I know that Cindy's going to pose some questions, but I do hope that this has been helpful for you as we think about our overall goals for today, our overall learning outcomes. I do hope that you will continue, that you will persevere, that you will spread the word, you will think about ways that you can further commit yourself and you can get others involved. It is all about investing in lifetimes. That's again, I think what helps me, and I hope will help you. And I leave you with this contact information. Please feel free to send an email, feel free to call, feel free to write. Again, I hope that this is helpful and met your needs for the webinar for today. Thank you for your participation. And again, Cindy, I'm going to turn it back to you because you're going to be fielding or have questions that someone has asked.
Well, thank you so much, Dr. Anderson, for sharing your expertise on this and the hard work that you've done in collecting all of this data. It was really interesting to move through. I'm sure many of you are interested about how you can take a closer look. We'll be posting a recording of this on our website, and we'll put a PDF of the slides on there as well so that you can review this again. Now is the time, if you have questions, to pose them to Dr. Anderson by putting them in the question box on the right-hand control panel. Go ahead and type those in now if you have them. And while we're waiting for those questions, I want to do just a couple of announcements. I encourage you to join us for our third webinar of our summer webinar series featuring our Executive Director, Dr. Jim Lang, on July 12th. That'll be looking at how we can engage residents' life and prevention efforts. And if you haven't done so already, I encourage you to register for that webinar. The short link for that is go.osu.edu/engage RA both being capital. So I encourage you to register for that webinar as well. If you have not done so, we want to see you in Columbus in October for our national meeting. It's our annual conference for campus professionals working to address substance misuse prevention across the continuum. And so we are hopeful that you'll be able to join us, and we encourage you to register by the end of the month to take advantage of our early bird discount. Our theme this year is implementing change in urgent times. We're really excited about the conference, and you can learn more on our website at go.osu.edu/NATLMTG18. And with that, I know we have a couple questions coming in. Dr. Anderson, this really isn't a question, but more of an observation. So knowing the current climate regarding fraternities and sororities post Penn State, we have people who are curious if there's a spike in special attention given to that population. Have you seen any of that in the preliminary data for 2018 yet?
So have I seen any, for example, in the specific question that we asked about, to what extent are campus paying attention to the unique needs of the following populations, is where we would find any increase in effort, and I have not seen any increase in effort. So I do hear a lot of talk by campuses and by national leadership, but the proof is going to be in the pudding. The proof is going to be when when, if you will, mainly the national organizations, and that's at the fraternity sorority level and at their organizing level, really get very, very, very serious about this. I think we need, also goes to one of the points I made in one of the closing slides about looking for more proximate measures. So we need to not just look at the bottom line behavior, but also look at, if you will, what are the perceptions by fraternity and sorority members? What are perceptions by the leaders of the campus fraternities and sororities? What are the perceptions? What are the beliefs about change, about appropriate role by the advisors on the campus, again, by the, if you will, the fraternity sorority leaders. And then at the national level, we're not capturing that sort of proximate data, which I think is vital for affecting ultimately behavior change. So the short answer is I don't see it yet. I would like to be hopeful, but until I see it, I remain concerned that we're just really not addressing it, and we're doing more lip service at this point.
Okay, I think that's all the questions that we have right now. Dr. Anderson, I just want to thank you one more time for your time today. I want to thank all the rest of you for joining us. I'm sure you're all very busy on this, hopefully beautiful for you, summer afternoon. And we encourage you to take part in our July webinar on the 12th, featuring Dr. Jim Lang. Dr. Anderson, thank you one more time, and have a wonderful day.
Thank you very much, Cindy, for coordinating all this.